let's talk about some of the bigger changes to Medicare in 2025. And what I'm finding is that the changes that you're seeing in the news or in the articles aren't necessarily the most meaningful changes in the new year for you to be aware of. So let's cover what those meaningful things are for you so you can find the best Medicare coverage, the best Medicare plan, and ultimately again have the best healthcare while protecting your retirement savings. So let's begin with kind of the overall parts of Medicare. And as a reminder, I'm Emily with the Medicare Coach. We are an independent Medicare consultant helping our clients easily navigate both the Medicare rules and the insurance company confusion to help you do what's ultimately right and best for you. So when it comes to overall Medicare, we're seeing really two big things, right? And it's around the premiums the premium and deductible, especially for your Medicare Part B as in boy. So Medicare Part B premiums for 2025 are going up to $185 a month compared to $174.70 in 2024. Now, the IRMA or the high income threshold is going up slightly as well. If your income is over $106,000 as an individual or $212,000 as a couple, that's when your IRMA threshold kicks in. So we're seeing some changes in those Medicare Part B premiums. We are also seeing the Medicare Part B deductible go up slightly from $240 to $257 in 2025. So changes. The Part B is bigger than what we've seen in the past, at least in the last few years, but nothing necessarily shocking from a 20% increase or anything else like that. So it's a pretty, I think, fair increase for what the inflation is doing right now in our country. So the other big changes that we're seeing on a Medicare Part B level is that they are cracking down or they are limiting your telehealth services. So there are still some telehealth benefits for 2025, but they are much more limited, and people are definitely disappointed in this because you're now having to go to your doctor for most of your appointments. So those are kind of the big high-level changes for Medicare in 2025. Now, when we think about Medicare, we also have Medicare Part D, Medicare Supplement, as well as Medicare Advantage. So let's kind of dig into each of those types of plans, talk about what are the changes there as well. So for Medicare Part D, the biggest changes that we're seeing this year is not necessarily the donut hole going away. It's really more the $2,000 medication copay cap. So as long as your medication is covered by your Medicare Part D plan formulary, your copays are capped at $2,000. Now, this has been helpful for many people. It's also been not a great thing for others because we are seeing that some of those expensive medications are no longer being covered. And so the best thing is that your medication is covered by a Part D plan because your copay is capped. But if your medication is not covered, there are other things to look at, but it's not as good for you as it is for others. Again, the copay cap only exists for medications on the plan's formulary. We're also seeing a lot of changes with insulins. So insulins are being covered or not covered or changed. And so our clients who are diabetics who are on insulin, we're having to make some changes with them and their doctor to help them understand how to get that $35 cap, that $35 copay cap for their specific medication. So we're seeing a lot of changes this year. We're not quite done with our annual review process as I film this, but about 62% of our clients are changing Part D plans, and the average savings is almost $3,000 a person. And so the changes have been meaningful for the upcoming year with formularies, insulins, all these other things, okay? Now, let's move to Medigap, also called Medicare Supplement plans. Overall, there are not huge changes there. Premiums are going up, yes, but it's kind of as expected and a fairly normal amount. I think what we are hearing from clients, though, is that a lot of the fitness benefits that certain companies offered in the past are being very much cut back. And so people used to have their Pilates covered or their personal trainer covered. That's not really happening anymore in 2025. And we're not finding plans that will replace those benefits. The companies have been pretty open about how they have to kind of cut back those benefits in general to help save them money. And so we're not seeing those kind of outliers of companies with the extra fitness benefits that can kind of skew people one way or the other. So disappointing for many, but unfortunately, that's kind of what we're seeing from a fitness standpoint for those Medicare supplement plans. Now, finally, Medicare Advantage has had a lot of changes, especially on networks of doctors. We're seeing a lot of networks dropping. We're seeing a lot of doctors drop Advantage plans. And so our clients are kind of trying to scurry around and see what they want to do. And so again, remember that Advantage plans work best when you're in a network that's covered by your plan. And if your doctor's not in network, it can be harder to see them. We are also seeing that Advantage plans are cutting back those same fitness benefits that I mentioned with Medicare supplement. And so we're seeing a lot of these extra perks getting cut back on all the plans. Overall, though, the fundamental core of Medicare is not fundamentally changing besides really those telehealth visits, but there are some nuances for every type of plan out there. So I hope you found this helpful. If you did, make sure you follow along for more inside tips. Give us a thumbs up. But again, we're here to help you easily make your right Medicare decision.